Hi, Dr. Washton.
Good morning, Gabriel.
It's great to meet you this morning. For our listeners, Dr. Washton is a widely recognized addiction psychologist and published author. He has 5 textbooks to his credit. He has 18 book chapters and over 40 published articles in referee journals. And I think you'll find what he has to say about substance abuse treatment and recovery very interesting. I would just like to say that my favorite of Dr. Washton books is titled Treating Alcohol and Drug Problems in Psychotherapy Practice, Doing What Works. And that's really what we're going to be talking about today, doing what works. Dr. Washton.
Yes, thank you for having me, Catriel. Appreciate it. And by the way, for your listeners, the new updated second version of that book is about to go to press and should be available in the months immediately ahead.
Okay. So Dr. Washton is going to tell us a little bit about total abstinence and moderation, and the difference, and if total abstinence is a solution for all problem drinkers. Please, Dr. Washton.
Well, abstinence versus moderation is probably the most heated controversy in the substance abuse treatment field today, and it has been for quite a while. Proponents of the disease model of addiction advocate strongly that once somebody has crossed the line from heavy drinking into alcoholism, that it's a one-way street, there's no going back, and that alcoholics can't be taught how to be moderate drinkers again. Another school of thought says that drinking heavily is a learned behavior that people practice over very long periods of time, kind of goes on automatic pilot, and that with some deliberate effort, a person can be taught how to better manage their drinking from a behavioral perspective. That is, to drink mindfully instead of mindlessly, keep track of what they're drinking, be mindful of their state of intoxication, and therefore limit both the rate at which they drink as well as the absolute amount they drink on a given occasion. But the question of can somebody with a significant alcohol problem ever transform themselves back into being a social drinker remains a critical and, at least in the minds of many people, an unanswered question. There are those who take very strong positions on it, especially those who adhere to the disease model of addiction, that attempting moderation or holding out the promise of moderate drinking to somebody who's a true blue alcoholic is dangerous and irresponsible. And there are others who say that we can't paint everybody with an alcohol problem with the same brush, and that some people have more severe alcohol problems, some people have less severe alcohol problems, and whether or not they can learn how to manage their drinking more safely and more reliably remains to be determined, and certain protocols have been developed to help people learn how to drink moderately. And if they give that a try under some kind of professional guidance and it works out, well, fine. If it doesn't work out, well, then a person is more likely to accept the need for abstinence if they see through their own experience that moderation is not a viable option for them. And in my practice, I see people who travel both of those roads.
I think one way of putting it is that moderation might be an initial goal, it might be an achievable goal, and it might also be tuned over time. That if moderation isn't working out, abstinence might be the way to go.
Yeah, one way to think of it is that a professionally guided attempt at moderation can be a stepping stone for some people towards possibly accepting abstinence as the better choice. I think that offering the option of moderation training helps more people come in the door of treatment. It encourages more people to come forward. Many people avoid treatment thinking that total complete abstinence and adhering to the AA 12-step program is the one and only way to deal with an alcohol problem. And regrettably, for as good as that program is, regrettably for many people, it turns them off to the idea of getting help. And that inviting people to come in, have a professional assessment of their drinking problem, map out a strategy that is consistent with their own goals, what they feel they want to do for themselves, can be very engaging and very motivating for people. And when somebody's given a trial of professionally supervised moderation, and they see that they are struggling with it, they can only get brief periods of time of drinking within reasonable limits, and then they lapse back into their former pattern. They come to see that moderation, at least at this particular point in time, is probably not a viable option for them. And so they are more likely to accept abstinence, at least temporarily, as a choice. And I think that has great value. It respects the idea that change is incremental, not all at once. And that sometimes preliminary steps have to be taken before one can achieve what they would see as their ultimate goal.
So I guess I know how you would come down on the question if I asked you, are 12-step type programs the gold standard for substance use recovery today?
12-step programs are invaluable. And frankly, when I see someone who is amenable to getting involved in AA or already has a history of some positive experience with the program, certainly makes my job easier, and it accelerates their progress. However, I think that clubbing people over the head with the mistaken idea that AA is the one and only way, and that if you're unwilling to get involved in the 12-step program, that in itself is a sign of denial or lack of sufficient motivation. I think that's a big mistake. There's no such thing as one pathway to recovery for everybody. I see many patients who are involved both in individual and or group therapy in my practice, and they go to AA meetings as well. And therapy and AA work very well together, synergistically, in a complementary way. They're not good substitutes for one another because each has its own strengths and each has its own drawbacks. And I think the two together are often better than either one alone. But if somebody is resistant to, unwilling to go to AA meetings, or has tried it and says that they are turned off to it, I think it's a mistake to try to have that become an obstacle to them getting proper treatment.
So how do you see the role of the clinical psychologist and the addiction psychologist in the recovery process? And in your case, I mean, you're wearing both hats at once.
Well, from a perspective of a psychologist, an addiction psychologist, a clinical psychologist, the substance abuse problem never develops in a vacuum. It always develops in the context of a person's life. That's purely logical, of course. Anybody can understand that. But what does that mean? It means that over time, the alcohol or drug use has become intertwined with all kinds of other issues in a person's life. That doesn't mean that those issues were causative. Those were the original roots of the addiction problem. They may have gotten intertwined and intertangled with the substance use along the way. It kind of doesn't matter at the time that somebody first appears for treatment. But we have to deal with the whole person, not just with their addictive behavior. Fixing somebody with the label of alcoholic, telling them they have to go to meetings, they have to stop drinking immediately, that's the one and only way to do it, without taking into context their life circumstances, previous attempts they may have made to address this problem, previous psychotherapy they may have been in, what kind of traumas have they experienced over the course of their lifetime. On the front end of treatment, priority always has to be given to the drinking or drug use behavior itself to try to get that under control, because it's very hard to make progress in psychotherapy, to teach somebody how to better manage their emotions, to get in touch with some of the forces, emotional forces that are rumbling inside them. That would be a very difficult thing to do on the front end of treatment. Goal number one is to establish a rapport with the patient, engage them in the process, motivate them as much as one can to change their behavior. And over time, it becomes pretty apparent what some of the issues are that their substance use is connected to. When you remove the chemical blanket of alcohol and drug use, now the person is no longer resorting to chemicals as a way of coping. And they get to feel their emotions, they get to grapple with their emotions, and ideally with professional guidance in psychotherapy, learn how to manage their emotions. That is the basis of true long-term recovery.
I guess I'm going to play devil's advocate for a moment, because I know that many of the clients you see are physicians, lawyers, finance professionals, various high-functioning executives, and they're managing to function with their substance abuse problem. So why should they come to seek treatment?
Well, high-functioning people are not exempt from suffering consequences of their addiction. They may be in a better position to hide it. Certainly the person who is the president or CEO of a firm, who's not accountable to their own employees for their time and their whereabouts, and can delegate authority and tasks to other people, quite naturally has an ability to continue their substance use and keep it hidden from others. Of course, in many ways, much to their own detriment, because the problem goes unrecognized for a very long period of time. But ultimately, something happens. It's more likely for a very high-functioning person like a physician, an attorney, a corporate executive, a business owner. Their home life is likely to fall apart before their work life. Their professional or work lives are usually the last thing to go. But relationships, particularly marriages, crumble. Home life deteriorates. One starts to become more socially isolated. Friendships go by the wayside. Other family relationships go by the wayside. Creates increasing loneliness and desperation and a sense of exasperation. And for very high functioning people in particular, who are accustomed to being in reasonably good control of just about all other aspects of their life, not being able to control and properly manage their alcohol or other substance use is very foreign to them. And it's a real blow to their self-esteem, to their ego, because they've come across something they can't control. And that can be humiliating. That in itself can become a motivator to come into treatment. I see people regularly who come in and even if no disaster has befallen them, which hopefully is the case, when I ask, why now? Why did you seek help from somebody like me at this particular point in time? Often part of that answer is, I am just fed up with myself. I never thought I would reach this point. I'm a person who usually succeeds at what I put my mind to. I've never come across a situation like this where something else is in control of me rather than me being in control of it. And sometimes that's enough to bring somebody into treatment.
Once treatment begins, what are some of the special concerns that an executive or professional tends to have that are different? And how do you address those concerns? I'm thinking specifically around confidentiality.
The number one concern among high-level professionals is confidentiality about, will other people find out? Is the confidentiality here in your practice, for example, is it airtight? Can I be guaranteed that other people won't find out about this? And of course, especially in a private practice where you're not encountering other people in the hallway, in a waiting room, etc., that confidentiality is ironclad. With more and more treatment taking place online, the confidentiality in many ways is even better because people do not encounter each other in a waiting room, for example, or in a hallway or in an elevator going in and out of my office, for example. The other concern is, what does this treatment have to offer me that previous treatments did not? I would say that more than 50% of the people I see for the first time have been in treatment before in some capacity. May not have actually completed a treatment episode, but had some experience, some contact with treatment. And they want to know what's different about this, because the chances are they have been in more traditional treatment. What's different and what's important to them is that and many have been in psychotherapy before and are concerned, will this treatment address my issues, the issues that are important to me above and beyond my alcohol or drug use? That is, I have a sense that I have other things going on that I need to deal with, maybe things I have not properly identified in the past or addressed in the past in attempts to do psychotherapy with a general practitioner, not an addiction specialist. Will there be an opportunity to address those things here? Because I think I can stop using. The problem is not stopping for me. The problem is staying stopped, because I've stopped many times. There's an old saying, a humorous saying from Mark Twain, when he was asked about giving up smoking cigarettes. He said, I've done it, giving up cigarette smoking is easy. I've done it hundreds of times, which is quite accurate. And that is, most people have tried time and time again to stop. But the issue is staying stopped. And to stay stopped over the long term means addressing some of the issues that underlie or are intertwined with a person's addiction, various kinds of psychological issues, both past and present issues.
I'm hoping we have just time for one more question. In addition to your one-to-one treatment, you also offer group therapy for people. And I wonder if you could talk a little bit about that group therapy option.
Small group therapy can be a very powerful form of treatment and accelerate clinical progress for individuals who are willing to at least give it a try. And the groups that I run are small groups. There are only 6 to 8 people in a group. The members are carefully chosen. These are like-minded people with similar levels of socioeconomic functioning who should and typically do relate well to one another. Group adds a dimension to the treatment that one-on-one treatment by itself cannot. And the reverse is true too. Individual and group treatment are not good substitutes for one another, but they do work well synergistically in combination with one another. In the group format, a person has a unique opportunity to get feedback from other people who are in a similar predicament and at various stages of overcoming their problems. So a newcomer can benefit from making contact with people who are months or even years down the line in their own recovery, and can share experiences of setbacks that they have worked through and what strategies they have used that have helped them to move forward. Getting that kind of feedback from several other intelligent people who've traveled a similar road can be extremely powerful and very helpful. So the group offers camaraderie, peer support, information sharing, helps people feel not so alone and so stigmatized by the problem because they see that other intelligent, high-functioning people suffer from this problem too. So they're less likely to feel ashamed and guilty. But group, as good as it may be, is not a substitute for individual therapy or vice versa, as I said before. It's in the individual forum where somebody can really dig deeper, get into some of the issues, in some cases long-standing, unresolved issues that percolate below the surface and perpetuate the addiction. And if those issues are not addressed, then the likelihood of staying sober over the long term is reduced, because these are the issues that continue to percolate below the surface and are likely to erupt at some point, maybe not dramatically, but continue to be there and erode somebody's ability to live life comfortably without resorting to alcohol or drugs as coping strategies.
Okay, that's so I think in this conversation we've kept our promise to talk about doing what works and maybe why it works and what's different. In our next conversation, Dr. Washton, maybe we'll have a chance to talk about harm reduction. Sure. But I think today we covered a lot of ground, and I'm looking forward to hearing what our viewers have to say.
Thank you very much. Appreciate the opportunity.
Okay, thank you, Dr. Washton.
Okay, bye.
Bye-bye.